Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Dizziness is one of the commonest complaints that bring patients to a primary care doctor's office. Dizziness is not to be confused with vertigo. They are not the same. The term dizziness can be applied to a number of different problems. Dizzy usually refers to a person being unsteady or lightheaded. Vertigo usually refers to a sudden sense of movement of the individual or the individual's surroundings. In describing vertigo, patients sometimes say that their head spins, or the room is spinning, rocking, or swaying. Vertigo may be precipitated by standing or turning the head. Individuals with vertigo have trouble walking and will usually be seen taking extra care when walking. Vertigo is a result of disturbances in the vestibular system or its connections to the brain. The vestibular system is a sensory system that is essential to normal movement and equilibrium. Its primary components are located in the inner ear. An organic cause can usually be found for vertigo. One sign of vertigo is nystagmus. Nystagmus is a vision condition in which the eyes make repetitive, uncontrolled movements. These movements often result in reduced vision and depth perception and can affect balance and coordination. These involuntary eye movements can occur from side to side, up and down, or in a circular motion. Some individuals will not have vertigo, but will have a loss of balance or instability while walking. They will not describe any sensations of vertigo. They will have a sense of disequilibrium. This sense of disequilibrium can be confused with vertigo. It is usually a result of a nervous system problem. The physician will take a detailed history and do a careful physical exam when a patient attends with a complaint of dizziness. The physician will want to get a complete picture of the patient's symptoms. The physician will ask questions such as, describe what happens when you have a dizzy feeling. Do you feel lightheaded? Do you feel that you or the room are moving? When do you get dizzy? Are you dizzy all day or dizzy intermittently? Do you have a ringing in the ear before you become dizzy? Are there any visual symptoms that occur before or during an episode of dizziness? Do you become nauseous before or during the episode? Have you noticed any neurological symptoms associated with an episode of dizziness? Have you had a recent head injury? Have you had a history of chronic ear infections? Have you had a recent cold? What drugs do you take? Do you take blood pressure medications? Do you take psychotropics, such as Xanax? Do you drink alcohol? Do you use marijuana? During the physical exam, the physician will do a full exam with attention being directed to the cardiovascular system, the central nervous system, and the auditory and vestibular system. The physician will examine the ears for any disease, the eyes for visual acuity and nystagmus. The physician will examine, again, the cardiovascular system. Blood pressures will be taken with the patient lying face upward, sitting and standing. Cardiac arrhythmias will be looked for. Evidence of atherosclerosis will also be looked for. The physician will evaluate the cranial nerves. These are 12 pairs of nerves that lead directly from the brain to various parts of the head, neck, and trunk. The physician will examine the patient's gait, the patient's reflexes, and the patient's coordination. The physician will also examine the neck and cervical spine. In summary, a comprehensive exam must be done. Investigative tests may include hemoglobin levels to evaluate the possibility of anemia, blood sugar level, an EKG to evaluate the status of the heart to see if arrhythmias are evident, audiometry in order to determine a subject's hearing levels, and also measure the ability to discriminate between different sound intensities, recognize pitch, or distinguish speech from background noise. Some specialized tests, such as brainstem-evoked audiometry, may also be done. This is an objective test that can be used to estimate hearing sensitivity and to identify neurological abnormalities of the auditory nerve and the auditory pathway up through the brainstem. Visual evoked potential testing may also be done. This is a painless, safe, non-invasive vision test used to objectively measure neurological responses of the entire visual acuity. There are other specialized tests that can also be done, but we'll not discuss them here. An MRI may also be ordered. We will continue our discussion of dizziness in the next video. I hope this helps. Have a good day.